Welcome to the Junior Nurse. In this video, we are going to talk about one of the most important practices in healthcare, hand hygiene. Hand hygiene is the process of cleaning our hands to remove dirt, bacteria, viruses, and other harmful microorganisms. It is considered the most effective way to prevent the spread of infections, especially in healthcare settings. The World Health Organization introduced what is called the 5 moments of hand hygiene. These moments help healthcare workers know exactly when they should clean their hands. First moment is before touching a patient, to protect the patient from germs that may be on your hands. The second moment is before a clean or aseptic procedure, to prevent germs from entering the patient's body. The third moment is after exposure to body fluids, to protect yourself and others from contamination. The fourth moment is after touching a patient, to remove any microorganisms you may have picked up. The fifth moment is after touching the patient's surroundings, because germs can survive on surfaces around the patient. Now let's talk about the correct way to wash your hands. First, wet your hands with clean running water. Second, apply enough soap to cover all surfaces of your hands. Rub your hands together, including the palms, the back of the hands, between the fingers, the thumbs, and under the nails. Continue rubbing for at least 20 seconds. After that, rinse your hands well with water and dry them using a clean towel. Now that we understand the importance of hand hygiene and the correct steps, let's move to the practical demonstration. Proper hand hygiene is an essential practice in healthcare that helps prevent the spread of infections and protects patient safety. Thank you for watching. Don't forget to like, share, and subscribe for more medical and clinical skills tutorials.